by the Health Minister Brad Hazzard, our Chief Health Officer Dr Kerry, Chant, the Deputy Secretary of New South Wales Health, Susan Pearce. Well, today is a very difficult day for our state. In the last 24 hours, we've had 36 people die with COVID-19, and can I extend, on behalf of the people of New South Wales, our condolences and our thoughts and prayers and hearts go out to all those families who have lost a loved one at this time. You know, we often, over the last 2 years, we can get focused on reporting the numbers. We shouldn't forget behind every one of those numbers is a loved one who may have passed away, or somebody who's in hospital or in ICU and going through a very difficult time. Can I extend my gratitude and thanks on behalf of the people of New South Wales to our health workers, each and every day on the front line, keeping people safe and looking after people's health care. They are an inspiration to all of us. It's been a difficult 2 years for everybody here in New South Wales, across the country, but our health workers have been there day in, day out, ensuring we have the best care and support available to us during this COVID outbreak. And so I want to really extend my gratitude to our nurses, our doctors, allied health professionals, our paramedics right across the board who are working tirelessly throughout this pandemic. It's been a difficult 2 years, but going through this latest outbreak on the front line, providing that care, that support to those who need it. I want to thank people right across New South Wales for the continued efforts, the continued sacrifices that people are making each and every day. Obviously, at the moment, as we move through this phase, there's a number there for the sake of it, and I want to thank everybody for following them. So whether that's the isolation period, which I know is difficult for those who have uploaded a rapid antigen test and it's been positive, or received a PCR test and it's positive, that effort to isolate for 7 days ensures that we keep our community safe during this period of time. And I want to thank everybody across the state for everything they're doing as we move through this phase, particularly what's been a difficult summer. But things like wearing masks, having gatherings outdoors. I know many people are doing that. We're seeing that at restaurants and cafes, more people sitting outdoors than indoors. It's incredibly important as we move through this next phase, and I know that everyone across our state is making those efforts, some small, some big, but all those efforts combined together ensure that we'll come out of this pandemic, outside this wave, stronger on the other side. There are difficulties. We've had difficulties over 2 years, and I know many people are tired of the challenges, are tired of those efforts, but that sustained effort, that sustained sacrifice that people have made has ensured that we've kept our communities safe, and ensures that as we move through this next phase, we'll come out stronger on the other side. I want to make a particular mention today of boosters. It's very pleasing today that we've almost hit 50% of the eligible population here in New South Wales who are receiving a booster shot. The evidence is very clear. Booster shots, vaccination, makes a real difference in protecting you, your friends and your family. We have close now 270,000 booster shots available to be administered a week just in our hubs alone. Ultimately, we know that many people will receive that booster shot through their GP and their pharmacies, but that support is provided by the New South Wales Government at 40 of our hubs across the board. And as we move through the coming months, more people will become eligible to receive that booster shot. And I just ask everybody across the state, it's very clear if we look at the ICUs here in New South Wales, and we see that 50 of the 209 people in ICU, once again we're seeing around 50% of people who are in those ICUs are unvaccinated. That's at a time when 95% of our population is vaccinated. So the numbers don't lie. The evidence is clear. Vaccinations, booster shots make a real difference in protecting you, your friends and your family. So continue that effort. If your time of 4 months as we come through this phase since your second dose vaccination, please make a booking. Susan Pearce will speak further to this, but there is substantial capacity in our hubs as well to either walk in or make that appointment, and I ask that people go and do that. We've made those efforts to get to that 95% vaccination rate, a rate we never believed that we would have achieved. But that effort that people have made across New South Wales has ensured that we're able to keep people safe, reduce pressure on the health system as we move through this phase. So I ask you to continue to make those efforts. I'll also just make a comment in relation to rapid antigen tests. We had over 1 million rapid antigen tests here in New South Wales procured by our government arrive yesterday. We'll have millions more arrive over the course of this week. They will be crucial in ensuring that we provide support for our health workers at this time to get schools open on the first day of term 1 this year. It's incredibly important that we get schools back on day 1. That is the commitment of this government, and we'll be doing so in a way that is safe for students, for parents and for teachers. As the World Health Organisation says, schools should be the first to open and the last to close. It's incredibly important for our children's educational outcomes, for their mental health, for their social understanding, that we are able to get kids back as quickly as possible, and that's why we are committed here in New South Wales to doing that on day 1, term 1. As a parent, I appreciate that many parents across the state are anxious about kids going back to school. We are working day and night with our health teams and with our education teams here in New South Wales to ensure we have a safe environment for parents, for teachers and for students. Now, in saying that, I know as we move through this period of time, just like we had last year, there'll be further inconveniences. There'll be bumps and hurdles along the way as we move through. We can't let perfection be the enemy of the good, and our focus is to ensure we have kids back at school on day 1. It's incredibly important, not just for their health, but for their educational outcomes, and we'll continue to work through that process as we take alongside other states. We're working very closely with the Victorian government to ensure that we provide those operational plans at National Cabinet on Thursday, and then we'll release those plans following that. Lastly, I'd just say, despite the challenges and the difficulties that are facing our state, they are not unique to the rest of the world. But as a state and as a people, we will get through this and come out stronger at the other side. We've done that over the last 2 years. Many people have made extraordinary efforts. Many people have made extraordinary sacrifices. But that effort, that sustained sacrifice, that patience, and continuing to keep and treat people with kindness and respect, they're the values that make our state great, and they are the values that will get us through this next challenging time. I'm now going to pass to Dr. Chant, who will give a public health update. Then Susan Pearce will provide an update in relation to the vaccination program in hospitals across New South Wales, and then Minister Hazzard will give a health update as well.
So there's currently 2,850 people in hospital, including 209 people in ICU, of whom 63 are ventilated and 9 are on special treatment called ECMO. We have 29,830 positive test results returned, and this is including 13,763 positive rapid antigen tests and 16,067 positive PCR tests. Of the 13,763 positive RAT tests, 11,564 of these are from the previous 7 days, and the 16,067 positive PCR results are returned from 67,549 tests. As we move through this period, it is critical that people continue to come out and get tested, be that through using RATs, rapid antigen tests, or through that PCR testing. It is important that people continue to isolate for that 7 days and then take those additional precautions in the 3 days after, wearing a mask, limiting your social interactions. And also for household contacts of cases, please continue to self-isolate for that seven days. You are at significant risk of acquiring COVID because of the nature of that household contact. And whilst the vaccines are incredibly important at protecting against severe disease, we know that they're not necessarily protective against you acquiring it or transmission, particularly for the Omicron variant. Today, sadly, we are reporting the deaths of 39 people. 22 men and 14 women. And can I just pass on my condolences to those for the loss. One person was aged in their 40s, 2 people were aged in their 50s, 1 person was aged in their 60s, 11 people were aged in their 70s, 12 people were in their 80s, 9 people were in their 90s. And of the 36 people, 33 were vaccinated against COVID. Generally, they had had 2 doses. 3 people were not vaccinated. Of the 3 people who died under 65, 1 was vaccinated against COVID, it had 2 doses, and 2 people were not vaccinated. All 3 of those under 65 had serious underlying health conditions, and of the older people, only a handful, 4, had had their boosters. So can I just echo the Premier's comments, and I know this will be echoed by Ms Pearce in her presentation about the vaccination. There needs to be a sense of urgency in embracing the booster doses. For Omicron, we know that the protection is lower, and we need that next boosting to get that higher level of protection. And we know that the boosters take about 7 to 14 days to work, and so I just really want the community to have a sense of urgency in going and getting boosted. Now, having said that, we still are trying to slow the transmission in the community because we want to give time for people to get those boosters to afford that protection, particularly for those most vulnerable. And again, recounting that, that's people over 65 years of age, pregnant women, people that have underlying health conditions, particularly those affecting the lungs, heart, liver, kidneys, or diabetes, and those with also immunocompromised or suppressed immune systems, either that be through drugs or the underlying condition. So it is critical that we get that booster dose, but we are also trying to slow the transmission, so that wearing that indoor masks all the time and wearing it appropriately. Please make sure it covers your nose and mouth. I know it is an inconvenience, but we know the evidence is so strong that that simple measure of having both people in an interaction masked significantly reduces risk. Please also note that we've got limitations on the singing and dancing, and again, the reason for that is those venues provide the opportunity for social networks to mix, and at this time we don't want to introduce COVID into new social networks. We really want to dampen down the transmission. Also, we need to practice those simple measures. So certainly go out and have lunch, but choose well-ventilated outdoor environments, particularly if you've got someone who's vulnerable with you, and perhaps take them to get their booster on the way to then have a nice lunch afterwards. I just can't stress enough the urgency of getting that booster. Ms Pearce will talk about the uptake in children, and again I do urge everyone to get vaccinated, and just draw your attention to the ATAGI guidance, which also says that it gives flexibility for some children that have very significant underlying health conditions, where the interval for vaccination could be shortened to 3 weeks to afford them protection, particularly as we re-engage with school. So again, a big thank you to the community. The fact that our projections are tracking under the current curve, the fact that the numbers have stabilised, give us some hope that we have been slowing the spread, but that is because of all of the actions you have been taking as the community in terms of wearing those masks and taking those protective actions. But we also at this time, with the high rate of community transmission, need to protect the most vulnerable. So also that rapid antigen testing before you're going into aged care facilities, also before you have those gatherings where you might be a wedding or other events. Those are very practical steps you can take to keep each other safe. So thank you.
Thank Thank you. The vaccination rates for our 5 to 11-year-olds is going very well across our clinics, and we've tried to make the clinics, the New South Wales Health clinics, warm and welcoming for the kids. We've been across a few of those clinics, and it's really lovely to see the kids coming forward and doing everything we can to keep them calm while they await their vaccination. Last week we did over 20,000 5 to 11-year-olds in the New South Wales Health clinics. We have capacity to do many more than that. And again yesterday over 3,000 children in that age group came forward, so it's very pleasing to see that number going up. Every single day we are seeing people come forward for their first and second dose in the adult population. It's not too late. So whilst obviously we're talking a lot about boosters at the moment, please don't think that it's too late for you to be vaccinated. We are ready, willing and able to assist you. With respect to the boosters, again, we have a lot of capacity in our clinics. Even today at Sydney Olympic Park, for example, there are thousands of bookings available for people to take up. Last week we had over 70,000 bookings available in our clinics that weren't taken up. So to echo Dr. Chant's words, there is a sense of urgency around the boosters. Please don't delay this. If you have the opportunity, please come to one of our clinics. We've made them very accessible, they're extremely efficient, and they're there to support the GP and pharmacy network. We just cannot urge the community strongly enough to please come and get that booster dose. And while 50% of the eligible population have been boosted, that means there's another 50% out there who are yet to receive that dose. We look forward to seeing you in one of our clinics as soon as possible.
Thanks. Just by way of clarification, Dr. Chant just asked me to emphasise that she misspoke. It was 36 people who passed away in the last 24 hours. At one stage she said 39, but that's because she's tired and working extremely hard to keep people safe in New South Wales. I'd also just like to express my condolences to all the families of those 36 people. As the Premier said, they're not just numbers, they're people's loved ones, their family members, their friends, and through this pandemic there have been people who've passed away in very sad circumstances. I just want to say again my condolences to all of those family members and friends. Can I emphasise this, that the relevance of vaccination is pretty obvious. Around about 5% of the population in New South Wales have not been vaccinated at all, and yet between 50 and 100% in individual hospitals of people who are in ICUs. So people in ICUs and individual hospitals make up between 50 and 100% of the people who are actually in the ICU. Unvaccinated people, total population, 5%. Total numbers in the ICUs, somewhere between 50 and 100%. There is no question that getting vaccinated is a crucial step forward, and I would ask the community, those remaining people who are still either reluctant or have just not got around to it, to get around to it, because it may save your life. I also want to emphasise my thanks to the community for complying with the health orders at the present time, and there are a number of health orders, public health orders that Dr. Chant has advised the government in relation to, and certainly the wearing of masks indoors remains crucial. Not singing and dancing in venues, hospitality, also an order. Please comply with that. Make sure that if you're an employer or an employee, remember the rule that if possible you work from home for the time being. Obviously we'd all like to get people back to their workplaces, but at the present time there is an order, having in mind the Omicron wave that has swept us just really only the last 4 or 5 weeks, but it is essential that those public health orders be complied with. In addition, there's advice from Dr. Chant and her public health team that it's wise to minimise the number of people in your home. The more people you're with, the more the risk. So if you can have a lesser number of people at home, that would be good. And certainly if you do what many of us are doing, which is try and have the gatherings outdoors. Picnics are great, lovely time of the year, get out and picnic. Finally, can I just say this, that there were some sensible steps taken by our public health team, and it's a big team, and they work very hard, but some of the steps that some people in the community take to undermine those steps are really, really disappointing. We introduced the rapid antigen test as something which you can register, and the purpose of that is to enable our public health team to keep track of the movement of the Omicron and Delta, although it's much less in the community now, so we can keep track of that movement through our community, and that informs the steps then that our public health team advise government in relation to. But I am aware of some reports that some people think it's a joke or perhaps even worse than that, perhaps it's malicious, to put in false reports to Health and to Service New South Wales about somebody being positive. I'd heard those reports. I can now speak from personal experience. I received notification yesterday and again today from Service New South Wales and from Health that apparently somebody has put my name in there as being a positive rapid antigen test. Can I just say, first of all, it's extremely irresponsible. You're undermining what the public health team is trying to do here to keep the entire community safe. It is juvenile, it is moronic, but it's also just so disappointing to think that you would actually undermine an incredibly hard-working public health team here in New South Wales trying to keep us safe. I also want to remind people who do that that there is a $5,000 fine for anybody who misrepresents any facts to the New South Wales health people who are trying to keep us safe. So the police will come hunting, and if you're caught, you'll cop a $5,000 fine. But worse still, when you're telling your friends down the pub how smart you are, perhaps they'll tell you how stupid you are. Just cease all that activity. It's quite moronic. And finally, I want to thank the staff again. You know, how lucky are we in New South Wales to have the most amazing health system, but more importantly, the most amazing people that make up that system. I want to thank all the doctors, the nurses, the allied health staff, the cleaners, the administrative staff, everybody who, when you go into a hospital or a medical facility across our state, and there are hundreds of them, I just want to have you think about the fact that those people are actually there looking after us and doing an incredible job. A thank you to each of them. I can tell you, people have told me who work in the system that just getting a thank you from somebody in the street when they see a nurse or a doctor in uniform and they thank them means a lot. So please extend that thank you. It's been a long 2 years. We're closing in on 2 years since our first 4 cases here in New South Wales, and a simple thank you really does go a long way. And as Health Minister, I say thank you to all of the health staff right across this state.
So what was the last question?
Why are you doing anything additional to slow the spread of the virus?
We believe that the changes we've made over the course of this period of time are proportionate to the circumstance that we find ourselves in. And what we're seeing is escalating case numbers, not just here in New South Wales, but around the country and around the world. Ultimately, we have these measures in place in the circumstance that we find the position here, and we believe that they are balanced and proportionate to ensure that we put downward pressure on the health system as we move through this Omicron wave. Obviously, there's some pleasing signs in relation to those numbers at the moment. We're not seeing the escalation that we have previously seen, but it's still too early to tell exactly where we sit. We're working through that at the moment. But ultimately, those measures in place ensure, in conjunction with the isolation requirement, which is a very crucial one, that people who do get that positive rapid antigen test, who do get that positive PCR test, to isolate. And I know that's a sacrifice, but that ensures that you're not spreading the virus to your friends and your family. I'd also just make the point, for those people who do have access to rapid antigen tests, that you don't need to do a PCR test. And PCR tests, and we've seen substantially those queues reduce over this period of time. That's incredibly positive in terms of ensuring that people don't have to wait in line, but in addition to that, that we get the tests back faster. So they're both working in conjunction with each other, the rapid antigen tests and the PCR tests, and I think the efforts that people continue to make ensure we stay safe as we move through as we've always said, is going to be a difficult 2 weeks.
How are you going to keep schools open and functioning
Yeah.
in a situation where administrators are being warned that upwards of 20% of staff will be off sick at once with COVID?
Well, our education teams are working very closely on that, whether it's schooling, whether it's health, whether it's businesses right across the state. We're certainly seeing challenges through these isolation requirements, but they are important in slowing the spread of the virus for somebody who is tested positive to COVID. Now, we are presenting those operational reports. As I have said, last year we faced difficulties and challenges as well. We had schools closed last year, but the overwhelming majority of schools remained open. So there will be inconveniences. There will be challenges as we go through the reopening of schools. There's no doubt about that. But we are determined to make it as smooth as possible. Now, that will mean at times teachers who are positive will have to isolate. It will mean at times that kids who are positive will need to isolate. But that is a better issue to be dealing with than having our schools closed. We need kids back in the classroom. It's best for them. It's best for their educational outcomes, their mental health and their social outcomes, particularly in disadvantaged groups across the state. We have in New South Wales, we've seen over this period of time, certain students lose a quarter of their schooling because of lockdowns and because of not being able to access education. That is not a tenable position going forward. So yes, there'll be challenges, I accept that. There'll be challenges in relation to positive tests. Our teachers will be on the front line doing everything they can to make this a seamless transition as we go into the start of the school term. But I will certainly say it will not be without its challenges, without its inconveniences to teachers, to parents and to students.
Do you have any concrete plans?
Obviously, Omicron is very different to Delta in terms of the spread. So are you coming up with a whole new plan for 2 weeks when the term starts?
Yeah, well, it's a comprehensive plan that we've got across the board that we're finalising at the moment with our health and education teams, and it will be a different plan than we had last year. Last year, when we had a case in a school, it was very likely that school closed for cleaning, and then many students were affected and had to learn from home during that period. Now, there clearly, as we move through this phase, there will also be learning from home as we move through. But there's a comprehensive plan that we are working through. We've agreed at the National Cabinet level that we'll provide those operational plans for every state and territory across the board. We'll be doing that on Thursday and we'll release it after that. But it will be different to last year. It's a different variant. There are different challenges facing the state with, as you say, Ash, a highly variant part of the disease, but in addition to that, one that is also less severe. So our focus is to ensure schools are open, kids are in the classroom with as least disruption as possible. But there will be issues as we move through, but that is the better path to take than to simply not have schools open on day one. Kenny,
If this happens, teachers having to isolate en masse, like, do you have a concrete step you can tell us about that?
The plan that we've released today is that students will be back in the classroom on day one, term one. Now we're working through the aspects of that. We're finalising those plans in relation to the direction of National Cabinet. The Department of Education and the Education Minister just this week announced that, obviously, to provide a buffer for teachers to the previous question, that there's a call on those retired teachers, those students who are in their last year of university study, to play a part in that reopening. And if we all work together, as we have over the last 2 years, we will ensure that we achieve that goal, that very important goal, to have kids back on day one. As I said, I'm going to keep saying it. There will be bumps along the way. We are in a pandemic. Everyone around the world is dealing with those challenges. We've seen and are learning from issues that we've seen overseas as they've had to reopen schools. Now, some jurisdictions have kept their schools closed. That is not an acceptable outcome from my perspective. We need kids back in the classroom, and we're determined to do everything we can to meet that end.
Logistically, how would that work? Plan to do surveillance testing where you test students twice a week for the entire term, or even potentially the
Well, I'm in that category, and but look, there will be difficulties as we go through. I'd make the point that we have not finalised our plan yet. So I did see the report today. There is consultation at the moment with the Department of Education, the Catholic education sector and the independent sector, and we are finalising those plans.
But is that something you're considering?
Yeah, absolutely. We see a role of rapid antigen tests, and that's why we procured here in New South Wales tens of millions of them. And we've already seen the first tranche arrive, and many more will arrive over this period.
And at this stage, is that the preferred plan?
At this stage, we see rapid antigen testing playing a role as we open up schools. We are working through that, and obviously the federal government has agreed that in those circumstances we'll have a 50-50 funding arrangement. We appreciate that financial support to help get kids back in the classroom, but we will be using the rapid antigen tests that have been purchased in New South Wales to ensure frontline service delivery. So that's for our health workers, whether that's for our students and our teachers, whether that's for vulnerable cohorts across the community, whether that's our Aboriginal communities in regional and remote New South Wales, or in addition to that, our social housing tenants. So right across the board, we will be deploying those tests to provide that support to people right across the state. When it comes to schools, they'll play a role. I don't want to continue to give a running commentary in relation to those plans as we are finalising them. What I can say is we're working very closely with the Victorian Government, who, as we know, are in a very similar stage of the virus as we are here, and where we can find where we can get that continuity of those plans together. I think that will be incredibly important as we move through the school year.
Premier, what about daycares at preschools? Will they be included in the rapid antigen testing?
Yeah, we're looking at that, and obviously that's been a discussion at National Cabinet. We want people to go back to work. I think, as Stephen Kennedy raised with premiers at the last National Cabinet, when you're looking at a furloughed work staff at the moment, if childcare and early childhood education centres are closed, that adds an additional 5% of the workforce that will not be in a position to go to work. As we have the health challenges, we have the economic challenges to balance with. We've seen over the last 2 years high unemployment rates. We have a duty as a government to ensure that people remain in work. We talk about an economy and having a strong economy. What's that really about? That's about providing opportunity for mums and dads across the state to go to work and provide for their families. Childcare and early childhood education play a crucial role in that. And that's why, if you look at the last 2 years, when we went into lockdowns, they were required by governments at those points in time in circumstances where we had a highly unvaccinated population. We now have a highly vaccinated population. We cannot push enough the focus on getting that booster shot, because getting that booster shot puts downward pressure on the health system, and we continue to open up society as we move through. So early childhood education, childcare, we're working through those plans as part of the educational plans. It's been raised at National Cabinet, and my view would be we'll have resolution of that towards the end of the week.
I mean, Dr. Chant mentioned before that we still limit the number of people we're having in our homes. That's an interesting recommendation from the Chief Health Officer. Why not mandate?
Well, we have recommended, when we announced a couple of weeks ago some of the changes that we made to our plan, we made it very clear if you're going out, try and reduce mingling. If you're going out, try and sit outside rather than sit inside. Try and minimise major home visitations where you can. And the reality is, the people of our great state are making those efforts. They're making those efforts. We're seeing that right across the board. It's incredibly pleasing. That effort, following that direction, and the take-up and the efforts that people are making across our state is ensuring we're keeping people safe. Now, there will be case numbers, and I also expect, as we have kids go back to school, and as we move through this next period of time, case numbers may increase again, but our sole focus is ensuring that there's downward pressure on our health system. As the Health Minister has said, we have the most amazing health staff in the country. They're the heroes of the pandemic. They're doing everything they can to keep us safe. But there'll be issues as we move through. But there's always checks and balances. We're always amending to move with the circumstance that we face. But I'm very confident we'll have kids back at school and we'll deal with those challenges head on.
But Dr. Chant says that you can't stop the spread to buy some time for these boosters. So how is keeping the status quo and, you know, just stopping dancing and singing and closing nightclubs that you announced 2 weeks ago, how is that going to slow the spread?
Well, we're already seeing that. We're already seeing that as the numbers come through. And the restrictions we have in place here in New South Wales, completely complementary to those restrictions that are in Victoria. We believe the settings we have in place are proportionate and appropriate. Every Friday we'll continue to release the modelling in terms of how we're tracking under each of those scenarios that we released in relation to our hospital plan. As we said last week, whilst the health system is under pressure, we are currently tracking better than the best case scenario. That's encouraging, reassuring and pleasing. But we continue to monitor the hospital situation, our ICU situation each and every day. Our health teams are working around the clock. But in the circumstance we find ourselves in today, we are in a good position. That does not mean there are difficulties and challenges that we are facing. But these are not unique to New South Wales. They are not unique to Australia. This is a global pandemic, and New South Wales and Australia is standing incredibly strong in the circumstances, and that is because of the efforts that people continue to make day in, day out. They are following that advice. They are limiting those home visitations. They are wearing masks indoors. They are moving outside as much as possible. So, well, there's no. What we've certainly seen is that by keeping society open, as we move through this phase, that is a much better position than going into lockdown. It is not a lockdown when people can go to a cafe, when business owners can open, when restaurants can open. I saw a story today of a restaurant that's actually doing a great trade during this period of time. That is a much better position to be in than to be in a lockdown situation. And that was a policy solution for a previous time with an unvaccinated population. And what we've seen as we move through, and it's part of the national plan. You know, when we're looking at the national plan, we're originally looking at a 70% vaccination rate. We're at 95% vaccination rate here in New South Wales, with close to 50% of people who are eligible for a booster going out and getting a booster. That's a fantastic thing. That ensures we keep people safe. It ensures that we keep as many businesses open. Now, that does not come without its challenges. It comes with staff having to not be at work in certain circumstances. At times, it means, as we've seen, particularly over summer, some businesses have to close for a short period of time. But better to close for a short period of time than to close for a long period of time. And we're doing everything we can in this state. As we learn to live alongside the virus. Learning to live alongside the virus has been a cliche that we've been talking about for the last 2 years. But this is now the reality. And it's now the reality in circumstances where we have a highly variant transmissible disease that is less severe, but importantly, we need to keep things open, we need to keep things moving, and by staying open, that will ensure we have a stronger economic rebound. And you know, I know there are obviously concerns in the business community. The Treasurer said yesterday, we'll always provide that further support. We've done that for 2 years. We've had the back of business and workers for 2 years in this state. We have deployed our budget to help people get through, and we'll do it again. But there is no doubt staying open is the best course. It is the hard road, but the right road, and that will ensure, as we move through this pandemic, as we saw in that report yesterday from Deloitte Access Economics, that we will have a strong economic rebound. The prediction is that New South Wales will have the strongest economic rebound of any state. Now, that's positive. That should provide hope, and let's remain positive as a state. We need to remain positive, united in the face of adversity. That's what we've done for 2 years. I know people are tired because we can't make or wish this pandemic to go away. We need to face into it, deal with it. It's exactly what we're doing as a state. Those efforts and sacrifices ensure we keep people safe, and we'll always ensure that we provide that support for businesses, that support for workers to keep them in work.
Hundreds of thousands of people have COVID or are isolating. You're asking people to stay home and limit their movement. You're asking people to work from home if they can. Many of these settings are similar to the lockdown settings that were in place during Delta. Why haven't you reinstated some
Well, let's make the first, in relation to the first point. There is no doubt that more of society is open than we had last year during lockdown. That does not mean that there are not issues that businesses are facing with challenges on it with staff. We accept that. That is part of the transitional phase that we are moving through. As we work through this, there will be different challenges and difficulties that come our way. But the worst case scenario is if you have a across-the-board lockdown at a time when we have a population that is highly vaccinated. What are you solving for? You're solving for locking down. Then as you open up, the virus will continue to spread. That is a very different, we're in a very different situation to where we were last year when we had a highly unvaccinated population. We had, as a country, to make difficult decisions. We are in a different phase, and that transition can be challenging for people. I accept that. It's a new message. It's an approach that differs from when we had a highly unvaccinated population. Now, the Treasurer, just like as I was Treasurer, and I remember being in press conference over the courses of the last 2 years. What is most important when you're providing financial support for businesses is that you consult widely, you work very closely with stakeholders, you identify the need, and you ensure that financial support goes to where it will make a difference. You don't provide financial support before a business closes. You provide financial support following that period. You assess the situation. That's exactly what the New South Wales Treasurer, Matt Keane, is doing. It's exactly what I did previously as Treasurer. No, I'm not saying that at all. No, I'm not saying that at all. So we are working through all aspects of that plan. Obviously, yesterday the Treasurer announced the support for festivals, and there are more changes and more support that is coming for businesses as we move through. And regardless what the Commonwealth Government does, regardless what other states decide to do, our approach over 2 years, which has kept people in work, which has kept businesses going, has been to provide that financial support to help get them through. The approach of the last 2 years has ensured that New South Wales has remained strong, and that approach will continue as we move through this phase. Now, I know that just because of the situation of the last 2 years, as we've moved through, there's always concern and issues. But look at the past experience, look at the government's approach of the last 2 years, and it is very clear. We have the backs of workers and businesses right across the state. Done that for 2 years. We've kept businesses open. We've kept people in work, and that's what we're going to do as we push through this next phase of the pandemic. Yes,
your statements are incongruous from what Dr. Chant is saying. So Dr. Chant is saying keep the spread as low as possible while we have time to get everybody boosted. And you're saying we're vaccinated, we need to move on. Are you following the health advice?
Yes. What we're saying, and Dr. Chant will support this, is that we have settings in place that are proportionate. We're also saying that that there's a focus in keeping businesses open, in keeping people in work. That they are completely complementary approaches. We have restrictions in place. They are the same restrictions that are in place in Victoria. They are restrictions that ensure society can open, but at the same time that puts downward pressure, particularly for those mass spreading events. As Dr. Chant said, and I'll pass to her for some further comments, those settings, those amendments that we have in place, we've always said during the pandemic, we will change the settings as we see appropriate. We focus on the ICU, we focus on the hospitalisation. That has been the approach this government has taken and will continue to take. And we address those settings, we look at those settings as we move through. But those settings that we have in place are proportionate to the situation we find ourselves in, and people are making those efforts and following those restrictions. It is clear, they're not in contrast to each other at all. We have restrictions. People are following those restrictions. In a perfect world, we wouldn't. But those restrictions are in place to keep people safe, particularly as we move through this next this next challenging time as we push through the peak of the Omicron variant.
Obviously, and Dr. Chant warned that yes, we've got 36 deaths today, that we're going to see this continue. So what do you say to people about this death toll as we push through and make no changes to the settings?
But what's mostly important in relation to that is that we have capacity in our hospitals, we have capacity in our ICUs, and we're certainly seeing that. Actually, we have to live in the world as it is, not as we want it to be. There are challenges we're facing not just in New South Wales but right around the country. And as we've moved through this wave, sadly, we will see more deaths. That's the difficult reality. That is the difficult reality of the pandemic. And behind those, as I said, behind those numbers, behind those 36 people who died are families, grieving families. For those who are in hospital and in ICU, you know, there are people and family that's providing that support. This is a difficult time for everyone across our state. It's been a difficult time for the last 2 years. The measures that we have in place and the investments, as the Health Minister has made, the investments we've made in our health system over the years. I mean, we're in a situation now where we're seeing other states who don't have as many cases as we have in New South Wales already using their hotels as hospitals. We're not doing that. We've invested over 10 years in government record amounts in our health system. At the start of the pandemic, we provided, it was an open checkbook for health. We invested $4 billion. We have an exceptional health staff, tirelessly working around the clock. And when I look at our health system here in New South Wales, it is by far the best in the country. And that means that we don't have to go into lockdowns. We don't have to do what they're doing in Western Australia and keep their border permanently closed to separate friends and families for long periods of time. We are able to take the decisions and the actions here in New South Wales because of the substantial investments we've made over many, many years. And despite the pressure, as we're seeing around the world, despite the pressure on our health system, it remains strong. And our health workers continue to do an inspiring and amazing job in keeping people safe.
Dr. Chant, if we could ask you a question, please. Where are we at with this outbreak? Dr. Chant, have we reached the peak yet, and are you expecting cases to continue to fall from here?
Look, I think I've been loath to always call we've reached the peak until we're all past it. And even now it's a very challenging time because the data sources, we have to use those multiple data sources. It's pleasing to see some stabilisation in the percentage positive of tests. It's great to see that our PCR test return time is more timely because that means that people are able to effectively isolate and take that preventive action. And also we're closely monitoring our hospitalisation and ICU rates. So all of those give us some indication of a stabilisation, but I'm not going to call that we've, we think we're there, but ultimately the other message is it is in people's hands. As the Premier said, we're expecting as social interactions increase with schools going back that we could see an increase in cases. And so we shouldn't underestimate the fact that the actions of every individual, the public health measures we've got in place, are actually contributing to what we see now in the numbers. And so I just would like to thank the community for taking those actions. It is important as we go through 2022 that I think all of us would just like COVID to be gone. I think all of us would have liked to have had one more round of vaccinations and then have it as a done deal. Now, for some diseases, we've been able to achieve that. But we won't be able to achieve that with the current vaccines available. And so 2022 is going to be seeing waves of going up and down, and we're going to have to tailor a series of responses. We're always going to have to protect our vulnerable. So, it is tragic talking about the 36 deaths, many of those are elderly people. So we're always going to have those protective measures for people most vulnerable in our community. They may be the group that going forward also gets more repeated boosters. And so we'll turn our focus from the population to picking out the most vulnerable. From time to time, we'll also need to be continuing to have those advice about additional strategies. As I've said, indoor mask wearing, limiting your household gatherings, moving outside Some of those things probably will be things we urge all the time during 2022, but at certain times we're going to need to amplify those messages and get the community to come with us. We've also got to consider flu and other viruses which we've been free of for the last 2 years. So 2022 is going to be this recalibration where we're using all the tools, including oral antivirals, which will hopefully become available in February, new vaccines. I mean, I think we need to be very open to the fact that there will be, we've got fantastic vaccines, but there may well be new vaccine technologies that come before us in 2022.
Last question.
Sorry, hi.
Last one.
I was wondering, by how much is the daily case count, the daily case numbers, and undercount, do you think? Because of difficulty in some parts actually accessing those tests. And is there anything being done that maybe being on the back end to avoid this duplication of tests? And what proportion of those are duplications right now?
So we are trying to deduplicate the numbers, and as I said, the Minister actually described the situation he described today, where people are actually putting in details that are not correct. That actually obviously compounds any challenges with deduplication, but we are working on that. I've got to say that whilst we've got an eye to the case numbers, that's just one piece of the puzzle that we put in place. We look at hospitalisations, ICU. We also look at those behavioural surveys which tell us about people's behaviour change. Also the intelligence we're getting from workplaces around absenteeism rates or the positivity that they're getting in their surveillance programs. So we're using multiple pieces of information to get a sense of where we are in the curve. As I said, as schools go back, we are expecting to see an uptick in cases, and so we will need to continue to do many things that we've been doing to keep that low. And we're also going to be balancing the fact that it is important. I've been, I think, a passionate advocate for children being in schools and the importance of early childhood and learning environments. And it is going to be the fact that we're going to have these trade-offs in terms of case numbers. But my most important message at the moment is boosters are incredibly important. And please, whilst I really want those 5 to 11-year-olds to get vaccinated, I'm very passionate about prioritising boosters for the most vulnerable, because as we've seen with Omicron, we need that third dose. Even though it's a milder disease, it's still going to potentially present quite a severe outcome. But having said that, we will also throughout 2022 tragically see deaths in older people. We know regardless of the vaccination, regardless of what happens, we will continue to see a disproportionate burden of deaths. I always hate to do any analogies with flu because we've been spending 2 years telling you that COVID isn't flu. And can I just say, people think flu is a mild disease and much milder than it actually is. Flu leads to significant hospitalisations for our over 65s and our under 5s every year. So just with that cautious analogy, we'd just like to say that we still do see year in, year out of the toll that flu will have. And at the moment, we're already doing preparations for what would happen if, when flu comes back, which inevitably will, because we're seeing that happen in the Northern Hemisphere.
Are you
Final question.
comfortable with the current policy and restriction settings, or have you recommended we tighten restrictions in any way?
So as I've described, I think I've given my broad-ranging advice, and look, I've just got to say thank you to the community. I don't get out much, but when I have been, it's been amazing. I was actually at Balmoral, and it was amazing to see families picnicking and all of those positive things. And I just want to say thank you to the community who have been adopting those measures and for taking heed of the restrictions that are in place.
Your advice was, though, to limit social gatherings in homes and indoors. Is that advice
So I think that what we're seeing is we're moving from where there'll be lots of messages that we give to the community, because and the community is going to have to make a lot of those risk decisions themselves. So I've spoken a lot about vulnerable people and the extra care you might take if you're planning a birthday function with your elderly grandmother, and the care that you might take in setting that up, as opposed to the considerations that might exist for younger. And I think that's going to be one of the complications. We've moved so quickly. Omicron's really been a much more transmissible virus. We've seen these high case numbers. So over the coming weeks, I think we're going to need to support people with that ongoing messages about the steps they need to take. But it is going to be around them understanding their own risk. But vaccination is a key component of that. But we will have other tools such as oral antivirals in the future as well.
Thanks, Emma.
Thank you.